Very nice to see you all. I'm Charlotte Marchandise. I'm the Executive Director of EUPHA, and we are really, really happy to host you for this second day kickoff meeting of European Public Health Week. We are here with many speakers from many organizations showing you the ecosystem of public health and global health. Let me take 2 minutes to present what is European Public Health Week, and then I'll leave it to you. I'll share some slides for that. I think it's all good. So it started in 2019, and every year it's getting bigger and bigger, and it's getting more participatory, because the full idea of European Public Health Week is that we are, if my slide wants to go, science-based, of course, but also equity-driven, grassroots-led, community-focused, and policy-aware, because we know public health is about people, justice, and resilience. So we have the science, we have the European Public Health Conference every year, but we know the conference is still a lot science-focused with scientists, and we don't reach out that much to countries. We don't reach out that much to national public health association, field community public health workers. And we want the statement and everything we do in European Public Health Conference to be live and to be hosted in countries in the field. That's why we have this European Public Health Week. This year, we have events in 21 countries with thousands of participants, with 292 events across the 5 days in many places, from very local to global, mostly in person, which is new. Some are online and many are hybrid. We have very fun things. Yesterday we had the dancing sessions, and we have very serious things. We had the opening in the parliament yesterday, which was the first time, and we were very proud to host important people. We have daily themes, and today we are on the global health, food system, health security, climate and sustainability, a very important topic. We'll see how we have a call for action in the next days. Please see all the events happening today. We'll talk about standing up for science in the global challenges. We'll talk about accreditation. We also have an hackathon tomorrow to see how we have innovation that is based on inclusiveness with the people, for the people. So my keywords: let's connect, reflect, and act. And let's see you at the end to see how we take it further, because it's not a moment, it's a movement.
So thank you very, very much, Charlotte. Very quickly, Monica, I would like you to briefly mention European Public Health Week, and also, of course, your role and EUPHA Next, but just very briefly, if you can.
Yes, thank you, Elena. Thank you, Simona. Simona and Elena are the masterminds behind this great event. Thank you for all the work that you've been doing. So we are here for the European Public Health Week. Thank you for joining us. And it's very relevant. And I very much thank Elena for thinking of including in the discussions the next generation, because we cannot talk about One Health, we cannot talk about global health, we cannot talk about anything if we do not involve young voices, which are relevant not only as a token to make sure that they are there, but also as an integral part of everything that we are planning and implementing. Thank you, Elena.
Thank you very much. So I'm the president of the Global Health section at the European Public Health, which is the youngest, I think, in the European Public Health Association, but beyond thriving, because I think we're over 1,200 members in just over a year. Very happy and honored, and for having had the pleasure to partner with WHO Europe, but particularly because Simona Seravesi, who's a technical officer for One Health, and we work together for this event, and I hope for many others to come. Was a joy to work with, and also we hope that we have bring a flavor from different sectors and different, let's say, parts of the wood in the ecosystem of One Health. For us, it's critical to have this topic in the global health agenda priority for the region and for the public health community, and I hope you will find the event interesting. So Simona, it's over to you. Thanks. You are on mute.
Thank you. Thank you for these nice words, by the way, Elena. It was also from my side a kind of a very great pleasure to work with you and Monica and Mara. As Elena was saying, I'm Simona Seravesi. I'm working as a technical officer at on One Health at the WHO Regional Office for Europe. And WHO Europe is quite proud to be the partner of the European Public Health Associations in organizing this important webinar as a part of the European Public Health Week. And I will give you very quickly a sort of landscape on the webinar today. As you know, the topic will be One Health, and we are very happy that we try our best to consider several angles of One Health as a pathway to better and a more sustainable future for all. The structures of the event will be around 4 panel discussions, and we have invited a range of distinguished speakers. They will share their insight on the key aspect of the One Health approach, and we will start with an overview of One Health at the WHO Europe with my dear colleague Sinaya, and also about the regional One Health coordination mechanism with our colleague from FAO. And then we will be focusing on health security and the pandemic agreement, and especially on the role of One Health. And then we will explore the innovative approaches in One Health by focusing especially on governance and collaborations. And finally, we will address another extremely important topic within One Health agenda, which is the building the One Health workforce. And at the end, we will open discussions and key questions and answers, and then we will have our closing remarks. So I'm pleased to give the floor back to Elena, who will introduce the first panel. So Elena, the floor is yours.
Thank you very much for this brief intro, Simona. As Simona mentioned, we would like to bring to attention of the community a couple of recent developments, including for the quadripartite, which used to be tripartite, and also to see the role of the region. In the interest of time, because we have a very dense agenda, let's say, it's my pleasure to introduce you to Sinaya Netanyahu, who will be giving a critical overview for this topic, touching upon the role of the regional health coordination mechanism in advancing the coordinated cross-sectoral efforts we have in the region and working on One Health. Sinaya is the program manager for the WHO Center for Environment and Health in Bonn, in Germany. And Sinaya, thank you for being with us.
Thank you so much, Elena. I just want to confirm that you hear me and you see the slide.
Absolutely, we can hear you well, and the slides display beautifully. Thank you.
Very good, thanks. So good morning, everyone, and well, happy, interesting week. I mean, it's probably going to be a busy program. So I want to concentrate on a couple of things. One is what WHO is doing in the European region. We work with 53 member states from Central Asia to the Balkans, the Caucasus, and Europe. And also I want to describe the quadripartite plans for 25-26, which was also presented to our executive last month. So I will quickly start with WHO. Obviously, I just want to make sure that everybody is aware to the newest definition of One Health from the last 3 or 4 years that was designed by OLEP. It's a very interesting, very updated definition that calls for optimizing and balancing the work between the 3 sectors. So coming back to WHO and what we are doing. So a few years ago, our regional director have commissioned a committee on sustainable development. It is also known by the Monti Commission, who also advised WHO to look after the pandemic more seriously and more deeply into One Health, but also on innovation related to One Health. Following that, our regional director has established a technical advisory group, which came up with many scientists, many experts in the region that contributed to the One Health discussion. And together with this group, we came to 6 regional priorities that are actually guiding us. One priority is to building and strengthening governance, leadership, and partnership. Without governance and leadership and partnership, you cannot really mobilize things. Governance is really crucial for One Health because you have to see how you are working together outside the silo with the 3 sectors. The second thing was strengthening prevention and preparedness capacity. The third one was promoting and supporting equitable, inclusive, and sustainable solution to tackle inequalities. The fourth one was building evidence on effectiveness of One Health, requiring more data and more research for actions in all fields, from AMR to zoonotics to economic argument, etc. And then facilitating also the allocation of sustainable financing. It's a not one-shot game. You cannot just invest 1 year on one project or on one prevention of one particular disease in one particular region. You have to look more strategically in this area. And the last one was cultivating and sustaining core competencies of One Health approach for the workforce, which will be also discussed today. In addition to that, we, WHO, looked into the pandemic funds, and there is several projects with specific countries that were being able to get an award, but also we worked in WHO also with our quadripartite on supporting Central Asia, and we were able to support them in submitting a grant, which won $27 million for 3 years for the 5 member states for the 3 sectors, agriculture, health, and environment in these countries, to concentrate and improve on 3 areas. One of them is surveillance, second one laboratories, and the third one is workforce. So with this pandemic fund, with this leverage, we are hoping also to be able to demonstrate a good implementation of One Health. We also integrated One Health into the Preparedness 2.0 strategy. We also support countries in lining with the One Health Joint Plan of Action and its implementation guide. So that means we are not just living in our own European region, but we are obviously aligning with the global agenda. So member states will receive one message, one approach that is being really coordinated and aligned from globally, regionally, and within countries. We also established in the recent year a collaborating center on One Health at the University of Dublin. We also made a huge move with the Healthy Cities Network, making mayors through the Healthy Cities Network committing to localizing One Health in cities, where many cities are experience One Health related issues, from vector diseases to wild animals entering cities, etc. Finally, finally, I mean, in terms of regional policies, we have adopted the Budapest Declaration. When I say we, it's actually the 53 member states. The Budapest Declaration is about environment and health work that is being agreed by ministers from both sectors in 53 member states, including the roadmap, where for the first time we adopted One Health as an approach for implementation. And also we adopted the AMR approach, the AMR roadmap for 2023-2030. So I will zoom in a little bit on these two ventures. So with the Budapest Declaration, about 2 years ago in June 2023, we had an Environment and Health Ministerial Conference. And that was the first time where nature and biodiversity entered the agenda of the member states as part of the triple crisis. So we are not looking just at environmental pollution, we're looking also at climate change, but also at nature. And within that, member states have agreed to adopt the One Health, but also nature-based solutions approach as one of their priorities. Since then, we are helping member states by establishing evidence on the importance of that. And we also have written the first report that integrated and explained exactly what is really the role of the environment and how the triple crisis drives actually many processes within One Health, and why it's very critical for the health sector and for the agricultural sectors and the animal sectors to consider those drivers like climate change, like pollution, like land change use, and biodiversity loss. And this is also supporting us in implementing better the One Health approach. The other thing that was done in Europe is the AMR roadmap, which was also focused on, looked at through the One Health lenses. obviously also integrating health system view, people-centric approach and partnership, mainly trying to reduce the burden of the impact of infectious diseases, but also reduce the levels of antimicrobial resistance, and also continuing the ability to treat infection diseases. So those are the outcomes that are expected, and we are hoping that in the years, the upcoming years, we will register quite a bit of advance in this area. From here, I like to move outside WHO and to expand the work that we are doing with the quadripeptide. So obviously, UA, the World Organization of Animals Health, is a partner. The FAO, the Food and Agricultural Organization, is a partner, and also UNEP, the environmental program, is a partner. It was established in 2021 with this joint, and UNEP joined in 2022. We focused on the interface of human, animals, and environment. And when I say animals, I want us to keep in mind that we have livestock, we have wild animals, we have pet companion animals, etc. But it's not only the animals, it's also the crops, etc. So it's really the integration of the food system, the health security, the health of the environment. What is the interface between them and how we can work together in order to prevent pandemics? So we looked into AMRs, we looked into zoonotic diseases and the environment and health, and we aimed to strengthen regional collaboration, but really the ultimate goal is to build country-level capacity because we are serving the countries. So we got together, the quadripeptide, and we looked into our vision, which is to support member states, not just to operationalize, but to accelerate the operationalization, because again, One Health is not a new concept. And we want to do that in order to prevent, prepare for, and respond to health threats in this human, animals, and environment interface. A lot can be said about the justification, the economic argument. I will just say it briefly. It has been established that there is a return on investment when it comes to One Health. Investing in prevention ultimately would reduce emergency costs. It will improve preparedness and also will achieve broader co-benefits because it's not really achieving one specific goal in human health, but it's really achieve or food or agriculture. It's really to achieve the co-benefits that can be driven by working together and understanding the interlinkages between the systems. However, we as a quadripeptide gained experience from working in countries, and repetitively we see gaps in three major areas. One is the governance, which if we don't tackle that, we fail. One is in financing, and by saying financing doesn't mean that we always need more money. We just need to allocate it in a wise way, and sometimes make sure that programs within countries are being the funding of that allocated well across sectors. So when I say financing, it's not always more money. And third is capacity. We could see gaps in different countries at different levels, but specifically in workforce, in labs, and surveillance. And when I say workforce, it's not necessarily the workforce within a sector. It's just the workforce that is not being trained to be able to communicate and work with other sectors. And this is really the 1 million question. I'll move quickly, and I say that we see ourselves as the quadripeptide, that we have 3 jobs, 3 roles. One is to strengthen leadership, the second one to enhance capacity, and the last one is to foster a partnership. For the sake of time, I'll quickly summarize the key actions that we see ourselves working and improving and making an impact in the entire in the entire European and Central Asian region. So we together, the quadripeptide, would be working more on surveillance and data sharing, expanding the links between data sets and identify the health risks. So again, it's not necessarily the data doesn't exist, but it's not coordinated within the same platforms, and it's not being analyzed across sectors. So we need to do more on that to extend also integrated system on AMR, zoonotic diseases, and environmental data, which is lagging behind. We want to strengthen institutional and multi-sectoral coordination and increase accountability of each sector by the collective accountability as well. We want to build more capacity when it comes to workforce, more training, more workshop. We want to improve awareness and advocacy on the interconnectedness of the human and animal and environmental health. We want to create more awareness on the economic argument, more awareness on technologies that can emerge out of this exercise. We will continue addressing zoonotic diseases, obviously, the regular one, the one that we already know that exists in the region, but also make sure that there is a risk assessment that is being performed, also understanding the drivers that are affecting them, like the climate change, etc. Then we also will promote more this neglected area, which is the environmental sustainability that for many years was neglected, bringing again the triple crisis into the game. Finally, our expected outcomes are stronger coordination among sectors, improved surveillance system, and increased capacity in member states. Because what we want at the end of the day is more informed decision-making, more accountability, more partnership, and more sustainable funding for One Health. Thank you.
Thank you very, very much, Sinaya, for a very comprehensive presentation. We are quite happy to have with us, exceptionally from FAO, a colleague or a person who has had an awful lot of experience spanning more than a couple of decades in managing different levels of increasing responsibility, Mr. Nabil Ganji, who is currently the Deputy Regional Representative for Europe and Central Asia and Secretary of the Regional Conference, to briefly, in the interest of time, speak to us a little bit about the quadripartite and the recent events of April and so on. So without further ado, thank you for using my link, Mr. Ganji. I think people see Elena Pitelos, but we can rename you. So please, it's over to you. Thank you.
Thank you very much, Professor Pitelos. It's a pleasure for me to be here. Simona, thank you for the invitation. And I can't say anything more after Sinaya's very comprehensive presentation, really, which represents all our work together. I have been involved first with AMR and AMR week. My first engagement in this regard was basically in 2014 at the national level. But basically extending from that to regional, and that involved only WHO. And then further on in 2017, where we had chief veterinarians from Asian countries and some Central Asian countries, basically meeting in Tehran, where I was sort of stationed at that time. So I'm glad basically that here I'm having in my capacity as Deputy Regional Representative for Europe and Central Asia, for this region to be the first to include the environmental arm into its regional mechanism. And I was happy to see that also that, again, four distinguished organizations, each within its mandate, see the common area or where the areas that basically lapse between them and work together rather than competing with each other within their mandates. This vision sets the path forward for our collective work and reaffirms our commitment to supporting the One Health joint plan of action. And as FAO takes on the chairmanship again of this quadripartite, I'm very happy and honored for us to see that actually this time round, as opposed to the last time that we had the chairmanship, there's an action plan. And we are going to be working on policy dialogue, mobilizing resources, and enhancing coordination mechanisms to connect the regional and the country level initiatives, as Sinaya basically mentioned. We aim to strengthen the collaboration by improving how partners communicate, coordinate activities, and identify shared opportunities, all while streaming our modes of cooperation. In line with this vision, FAO will strive to increase knowledge and evidence base through scientific engagement. We'll promote platforms such as the webinars like today's. Moreover, some workshops to strengthen the overall evidence base and support action. enhancing advocacy and visibility for the One Health and the Quadripartite Alliance. I mean, until now, for instance, some people say, ask us, what does FAO have to do with the One Health? And from there, we have to sort of get into the transboundary diseases and the transmissible diseases to humans, which I guess by now our population or the public knows quite well about. Turning to the regional context, it's important to acknowledge the particular challenges we face. Many of our countries are in transition, and while some are on the path towards EU accession, they continue to struggle with modernizing their livestock sectors and veterinary services. These challenges hinder progress in disease control and in achieving efficiency and sustainability. Despite these obstacles, the life sector contributes to an average of 40% of the agricultural GDP in our region. However, it remains vulnerable to multiple threats. Transboundary animal disease, such as foot and mouth disease, which again, we have seen recently where I am in Hungary and some of the neighboring countries, as well as zoonotic diseases like brucellosis. All of those pose significant challenges, not only to the animal health, but also to public health, especially for rural populations who depend on livestock for their livelihoods. The COVID-19 pandemic was a stark reminder for all of us that emerging infectious disease can have devastating consequences. It was a wake-up call, I guess, underlining the critical need for early detection, accurate diagnosis, and rapid responses capability. But above all, for collaboration, both between countries and between regions, to ensure the health of both animals and humans. Regrettably, serious gaps still exist across our region in these areas. Moreover, the imprudent use of antibiotics in animal production has exacerbated the global threat of antimicrobial resistance. In many countries, the absence of robust surveillance systems means that the scope of the problem remains largely unknown. To address these gaps, FAO is committed to enhancing the capacity of veterinary services, enabling them to conduct more effective surveillance and early warning for both zoonotic disease and AMR. Our support has already yielded tangible results. For instance, in the field of TADS, we have assisted Azerbaijan in achieving official PPR-free status from the World Organization for Animal Health in 2024. We also supported Georgia during a PPR outbreak by providing 1 million doses of vaccines. And we are currently assisting Uzbekistan on a large scale serosurveillance campaign to help demonstrate freedom from PPR. Similarly, in the fight against AMRs, FAO has supported the establishment of laboratory capacity in several countries. However, for these initiatives to be sustainable, and continued support and strong government commitment are essential. And this is something that we are working on together in this regard. We are also actively supporting efforts to control brucellosis by helping countries improve diagnosis and gain a deeper understanding of this disease's epidemiology. In conclusion, FAO views the chairmanship as an opportunity not only to advocate for the One Health approach, but to implement it across all dimensions, from zoonotic diseases to AMR and, of course, environmental health. We are committed to working at both regional and country levels to ensure that One Health is not only a shared vision, but also a shared reality. Thank you so much. Thank you.
You are muted, Simona.
Thank you, Mr. Nabil Ganji, for giving us this view from FAO, and thank you, Sinaya, to my colleague Sinaya. So we have now to pass to the second panel discussions, which will be we will touch a very complex very complex topic, which is the health security and the pandemic agreement. And of course, the role of One Health and when One Health is positioned within the pandemic agreement. We have extremely distinguished guests and speakers. So we have, I will introduce the speakers. We have Dimitra Lingra from the EUPHA president. She's the EUPHA president, Law and Public Health. She's a researcher at the Mediterranean University in Greece. Then we have our Elena Petelos, EUPHA President, Global Health Sections and Vice President of the Law Section, Senior Lecturer in Evidence-Based Medicine and Evidence-Informed Policy, Senior Research Officer Fellow in Public Health at the University of Crete and at the Maastricht University, Greece and Netherlands. And then we have Julia Langer from the Health Security Unit, DG Santé, European Commission. So let's start with Dimitra Lingra. So Dimitra, the floor is yours.
Thank you very much, Simona. So just to give a brief overview regarding where we are in regarding pandemic treaty, discussions and negotiations started some 3 years ago, and then on March 2023, negotiations started on zero draft. Some few days ago, after 13 formal rounds of negotiation, WHO members agreed on a final draft proposal agreement. And next week, this finalized draft agreement will be presented in the 78th World Health Assembly in order to be adopted. And according WHO, by 2027, the treaty is expected to come into effect. So why wait, if everything goes well, why wait 2 years for the treaty to come into effect? That is because the treaty is an international legal agreement with binding terms, but it does not have a direct effect. That means that after its signature, it will be not come into force automatically. There are 3 steps. So first the signature, then the ratification, and upon a sufficient number of ratification by sufficient member states, then the treaty will enter in its implementation phase, where each member state will decide how and by what procedure will implement the treaty, and how the specific mechanism of monitoring prescribed by the pandemic treaty will be established. Back to you, Simona. Thank you very much.
Thank you, Dimitra. Thank you very much for these descriptions. And I will give you now the floors to our Elena.
Yes, so in the interest of time, I will try to be a little bit less comprehensive and refer you to what we have done in the past for raising awareness for the treaty. So the INB was indeed convened in December 2021. And although European Public Health Association is not in a consultative stage, some of us were involved in the INB in different hats, let us say. So we had the pleasure to partner with various entities and to try and raise some awareness on what was being discussed. And maybe some of you remember that when this conversation started, there were even thoughts about this mechanism going under WIPO, for intellectual property, because of knowledge transfer and different technologies and so on, or even going under WTO for trade and so on. And so to some extent, I think big success was starting this negotiation under WHO and discussing establishing an instrument under WHO constitution. Now, Dimitra referred to the 9th intergovernmental INBs, which have been painful, I think, for all of us, but there were numerous intersessional activities, 13 by then INBs in the end, and a very different text to the text we started out with. In the beginning, I think the emphasis in the discussions, because we're amidst the pandemic, had to do with a lot of discussion on preparedness and response, progressively prevention aspects or even promotion aspects, and you will hear about this a little bit later on, were discussed. And we have had very wonderful, I think, interventions on One Health that managed to become the overarching approach for the entire pandemic accord. And this is reflected, if some of you have seen the text of the treaty, in the entire chapter 2. This is dedicated article in the treaty to One Health approach being the overarching approach for discussing everything starting from prevention and preparedness and going over to response and, of course, resilience. But also there is the discussion on what would that mean beyond acknowledging the interface of animal health and human health and the environment. And there are aspects that are critical because they discuss the development of technologies, but also the prevention from resulting in zoonotic transmission. There are aspects that discuss how we can engage with communities for that, and there are aspects that discuss critically the workforce. And largely, I think to this extent, this is why we left the last part of this meeting to discuss this aspect a little bit more. And the current text acknowledges the importance of ensuring sovereignty of member states, examining and determining what their own policies would be, but does mandate that they actually consider the One Health approach throughout, which is a success in itself. Now, there is a tiny, let us say, part article further down the treaty, which is really discussing community engagement. It discusses indigenous population, discuss empowering communities, and so on. And this is very important. I think you already heard a couple of speakers discuss funding and cost and instruments because member states have very different capacities and capabilities. And the funding instrument, I think we are already in discussions for the PBAC for the pathogen access resources and so on. It's very important to discuss what this means in terms of capacity building and in terms of training, not only for the public health workforce, but also for interdisciplinary cross-sectoral collaboration, because we have different aspects and the one have different aspects of security to consider, aspects that have to do with food security, but aspects that have to do also with biological hazards and different type of emerging threats. So despite the changes in the text, we have a different version from the very ambitious one, despite perhaps a lot of work that is ahead of us, this has been a success. I think it's interesting because I will transition in this time to, I think, to the next speaker. It's important to know that there's more awareness about this in our communities, and we hope also this will be the case across the sections of EUPHA and across the public health and global health communities and the implications thereof. And it's also important, and we're happy to see this awareness rising across the different directorate generals of the European Commission, be it the EMA, be it HERA or ACDC, and of course within DG Sante, the Health Security Unit. And I think in the interest of time with this, because we are well over time, although for good reason, of course, with our wonderful extra speaker, we go over to Dr. Lange, Julia Lange from DG Sante. Thank you.
Thank you. Very good morning to you all. I'll try and be brief, but I did actually prepare a few slides I could share. Let me just let me see if it comes up. Can you see my screen?
It's starting to share, but not yet, but it's getting there. Yes, now we can see just the treaty. You're sharing the treaty.
No, it's
Email.
the PowerPoint. Here we go. Can you see the PowerPoint now?
Yes, we can. It's not yet in slideshare mode, but we can see the slides. Yes.
Slide share mode. Bear with me.
Yes.
Is that better?
No, we now see nothing. It's blacked completely.
I think it's coming now.
Yes, but we can see from the text pandemic treaty down, there is a blackened part in your, yeah, this should be okay. Yes.
Is it sufficiently good?
I think so. I think so. We have.
Okay. All right. Okay, so yeah, my name is Julia Langer. I'm working in the Health Security Unit of DG Sante, and I'm also sitting in the negotiating team working on the pandemic agreement. So I will go quickly through this, but I do want to just underline that the pandemic agreement was obviously not being discussed in isolation. Parallel, we also, for quite some time, we also had the international health regulations and their amendments. So for us, the negotiation team was actually working on both, and the IHR finalized last year. And maybe, well, I think the previous speakers already highlighted quite well where we're coming from, coming out of the COVID-19 pandemic and some of the aims and goals that there were for the pandemic agreement. Just before diving into kind of the EU's mandate, I just want to highlight, that we have a council decision and highlight a bit how closely we were working with the member states, because sometimes we get some questions around, kind of how this is working, all the coordination with the member states. So we have a council decision. This is kind of our mandate, and annexed negotiation directives, which really set out the kind of key areas to focus on, and also some of the kind of, priorities and red lines for the EU. Our chief negotiator was our Director General, Sandra Galina, supported by the negotiation team. And this was also really across DG negotiations, I would say. So we had really close association with DG INTPA, HERA, ECDC, also DG Trade. The pandemic agreement really spans quite widely across areas that are affected beyond, core health areas. We also had technical coordination meetings with the member states in Geneva. And in addition, there was a council special committee in Brussels, basically also advising on the progress and key decisions. And just to kind of, it was also already highlighted a little bit earlier, the outcome we have now is a little bit different to our initial plan. That's why I wanted to just bring up the EU proposal, which was initially submitted in 2023. So that was really to have, this remained a key focal area throughout the negotiations, but to cover the whole pandemic, prevention, preparedness, and response cycle. And I think Elena nicely highlighted how there was a lot of focus on response, and kind of the prevention element was often quite overseen or not shared equally the priority amongst all the WHO member states. So prevention was really something important for the EU. And initially there was, foreseen to have a whole article on One Health and on AMR. I'll come later to what we got in the end, but really spanning across, very encompassing and broad provisions were envisioned around risk surveillance and control, zoonotic spillover, the human-animal environmental interface, also addressing laboratory release, early identification and reporting. And just maybe to highlight some of the key outcomes. Unfortunately, we don't have time to go into everything, but I guess I wanted to just extract some of the key wins. So one is the use of terms. This was really debated up and down the ladder. We spent a lot of time on this. There was some resistance. Obviously, starting point was the OLEP definition. And this is kind of more adapted and tailored to the pandemic situation. But this was really one win to have a use of terms on the One Health approach. We did land an article on pandemic prevention surveillance. Initially, there was also, or at one point, there was an idea to have an annex. When negotiations were looking a little bit difficult, the idea was to kind of shift that to have kind of more like focal areas and then to shift the details into an annex that could be later negotiated. But yeah, in the end, it was decided to maintain Article 4 and 5 without an annex, and to kind of have those a bit more fleshed out. And then so a lot of provisions in Article 4, I would say, are contributing towards One Health. And then there's also a dedicated One Health article. And here some of the kind of key achievements were to have promotional activities, to recognize the interconnectedness of people, animal health, and the environment. That was a very difficult fight at some point. There are some views amongst some countries that the health of people should have kind of a higher standing, but having the kind of interconnectedness was definitely an achievement to have this recognized. And also having a commitment to take measures for identifying the drivers and addressing them, and also to have interventions in, well, appropriate national or regional PPPR plans. And also to take measures for promoting the health of human, animals, and the environment. And also, this was another, obviously we were negotiating under the auspices of the WHO, but also to have this last reference to have other intergovernmental organizations associated was also something that was maybe not so straightforward for everyone. So it took quite a lot of work to have that included. Yeah, this is kind of in a very, very brief nutshell, kind of the outcomes that we have. Yeah, the EU was maybe a little bit more ambitious when it came to One Health, but nonetheless, you know, we need to recognize, yeah, some of the key priorities of other countries. Of course, resources and availability of funding always featured quite heavily. And this is kind of the compromise we landed with. But still, we see this as a success, and that we kind of stayed within our red lines, and that we also managed to have good provisions on prevention and also on One Health. I can skip this slide. It was mainly just to highlight all the different challenges that were faced by the member states. It's really a very wide-spanning agreement, going into all kinds of directions that might not be, like me coming from a more health background, were not so immediately evident, but then you really saw how health is interconnected with a lot of sectors. You know, issues like intellectual property rights coming up, the parallel negotiations with the IHR and the pandemic agreement, at least in the early stages, was really quite a challenge, how to delineate between the two. The time pressure, I think the initial deadline was really very ambitious. There was an extension of 1 year. So the initial foreseen deadline was last year, and then it was decided that, you know, not sufficient progress had been made for an agreement already, so it was extended by another year, and the negotiations have been difficult. And obviously equity and access was a very, very, very important issue for a lot of developing countries. And sometimes it was maybe a bit seen as a trade-off, having, you know, having provisions on prevention, One Health, and then having provisions that were more closely linked to equity and access, like the Article 12 on prevention, pathogen access and benefit sharing system. But yeah, we're quite pleased to have the full spectrum of the pandemic cycle kind of covered. This is just in case you want to share the slides later, because I think misinformation, disinformation also featured quite a lot during the negotiations. So the EU did publish all the textual proposals on the EAS website. So anyone that wants to have a look can do that there. And just looking forward now, what does it mean now for us? So just next week, there's going to be the formal adoption at the World Health Assembly. And then we also have a few further considerations. So we still have a pending negotiation on an annex for the pathogen access and benefit sharing system. A 1-year deadline's been set. And after the negotiations on PABs have been concluded, there will then be the signature and also the other steps that previous speakers outlined on the ratification, accepting, and approving. You know, right now, EU member states are going through their national procedures ahead of next week's adoption. And then further down the line, there's also funding and implementation considerations. And maybe just to highlight, this can look like a very, very long path, but now we already have the core text there. So already the orientation is clear, and we don't need to wait until the very final steps to get going in full. I think there's already a lot of, we already have clarity on some of the key provisions, so it's already possible to start working towards its implementation even before it's fully ratified. And with that, I hand back over to you.
Thank you very, very much. It is a long-winded procedure. Just to say, you can find on YouTube, we have done lots of events as we went along the treaty, and we will do many more coming up because there's lots of things that were delegated for negotiation after the resolution is reached. And of course, hopefully we want the engagement of the local community. We have seen that there are a couple of questions in the chat. Because we are well over time with the interventions, I will pass the ball to Monica, who's moderating the next panel, but we will answer all of the questions once we finish with interventions. Thank you. Monica?
Thank you so much, Alana. Thank you, everyone. Now we're going towards the next panel, and the title of this panel is Innovative Approaches from One Health Governance to Interdisciplinary Collaboration to Protect Our Environment and to Increase Health Security. And to discuss more about this topic, we will have Marlene, Katie, and Maria. Marlene Becker will be our first speaker. She's representing the EUPHA Public Health Politics and Policy section, and she's an associate professor of health policy and politics at Wageningen University and Research. Katie Woodland from KW Green Governance Solutions and chair of the technical advisory group of the Nature for Health Initiative from Australia, and then Maria Feio from One Aqua Health Coordinator and a principal investigator at the University of Coimbra, Portugal. I will give the floor first to Marlene. Marlene, please. Thank you.
Thank you very much, Monica, and thank you for inviting me to give some short comments. Very impressive to hear that after such difficult negotiations, we finally do manage to have important requirements in place for the governance, international governance of pandemics using a One Health approach. So thank you very much for these presentations. And I just quickly want to give you some highlights on some work in progress that we have been developing in the Wageningen University in the Netherlands. Commissioned by the European Free Alliance Greens group in the European Parliament, we developed a One Health policy screening tool, which is just a first prototype tool. You might say it's the first step of a One Health impact assessment. Just to support policymakers and political staff in making quick decisions by non-experts in a very highly intuitive way to support their strategizing and influencing for policymaking. And just a few highlights are that using existing frameworks on the several core dimensions of One Health, like, for instance, the planetary boundaries framework and the Convention for Biological Diversity. We set up this index of key indicators. And additionally, in the second row, we developed ideas about the policy integrative infrastructure. So that's basically the governance of One Health and how is the quality and strength of the underlying organization. And just to highlight that this is still work in progress, but we are updating this section to make sure that it addresses both the multi-level component of governance, which is very important to involve at the local level communities, but also at the international level, the global governance regime. But also arrangements for intersectoral coordination and transdisciplinary working, because like me, I'm a scientist, our zone of comfort is in our own disciplinary area, but we really need to step out of our comfort zones and start collaborating with very different disciplines in this area. And lastly, also focusing on the transformative governance strategies and theories of change to include the indirect drivers of One Health into our approaches. So really adopting the systemic approach that is also very clearly visible in the quadripartite and the high-level panel definition. So we basically translated this index into like a turntable model, you might say, where you can really intuitively test the policy salience or relevance of different components of One Health in legislative or policy proposals. And we developed a checklist as a practical tool to follow these particular steps, also identifying trade-offs and synergies between different approaches to core components and indicators of One Health, and to also make an inventory of the global and local governance context to tailor the approach to what is locally or at the appropriate setting level necessary. So I'll just stop sharing my screen here. I understand you cannot read the text, it's not necessary for now, but I just wanted to make a few other comments while evaluating such technical tools in a highly political context, right? So I think one of the main lessons to be learned is that it's very important to understand the political context. So having a technical tool in place is really nice, but if it doesn't organize the policy dialogue with the stakeholders, including civil society, and really having balanced representation of interests, then the technical tool will only have limited contribution. So yeah, we really need to see how these impact assessment or policy screening tools can also become politicized in practice. We often see this happening. I've conducted multiple evaluation studies of these kinds of tools, and instead of trying to avoid such politicization, we might also think about how can we leverage this kind of politicization in a smart way. We can also see sometimes that certain interests might capture such processes or such tools and leverage the delay it may bring to decision making. But if we bring in the equal representation of interests, then we might also be able to secure the procedural justice and to make sure that the evidence that the technical tool brings will also make an effective connection to the meanings that communities attach to the public values of the different components in One Health. And then I think what's also important is to acknowledge that in the multi-level governance approach, the governance requirements are very different. So at the global level, we do not have democratic accountability, and the legal structures work very differently from democratic states. And this requires really a far more hybrid approach to, for instance, governance and accountability. And this is something that we need to develop further to make sure that the One Health component is really also leading to implementation, and it complies with existing regulations in other areas. And I think for the public health community, if I may, just to end my contribution, I think it's extremely important that we realize that we need to communicate also to non-expert and non-academic audiences and communities. And we really need to leverage the power of, for instance, the electorate to have a change in decision-making that finally will also lead to more conducive systems and institutions. So that's where I'll end my contribution here.
Thank you so much, Marlene. Yes, it's very important to discuss and to collaborate how we can respond to everything that is happening. And I would like now to give the floor to our next speaker, Katie Wollaston. Please, Katie. Thank you.
Thank you, Monica, and thank you for having me all the way from Australia for your European Public Health Week. There are so many things I could say about governance and environmental and ecosystem health, but what I want to quickly say in the very short time that I have is that the importance of ecosystem health cannot be overstated with respect to the One Health approach in public health. So when we're talking about One Health, you know, that the expanded definition that OLEP has provided, it's not just about infectious disease. It's not just about AMR. It's not just about linking zoonotic spillover to biodiversity. It's also about pollution. It's about ecosystem services, the clean water that we drink, the role of soils and pollinators in food production. Our mental health is linked to our green spaces and our ability to get out into nature. And so these are all connections that public health specialists need to be thinking about when they're advocating for ecosystem health under the One Health approach. Now, there are two specific environmentally led policies that are crucial to innovation in the One Health governance space that haven't been mentioned yet that I'm going to quickly mention. The first is the Global Action Plan on Biodiversity and Health, which was adopted by the Convention on Biological Diversity Conference of the Parties last year in 2024. And that's a culmination of a very long process by those in that environmental sector and the CBD to progress the broad interconnections between biodiversity and health. And the document itself, and I recommend you have a look at it, includes many low-cost quick actions that can be taken up in the short term at a national level to really broaden the interconnections between biodiversity and health in your policies at a national level. The second thing that I will very quickly mention is the right to a healthy environment, which was formally recognised by the United Nations General Assembly in 2022. And really importantly, for governance, where we're all from different sectors and we have this interdisciplinary approach where we all speak different languages and have trouble understanding each other a lot of the time, what the right to a healthy environment does is provide a common language in the language of human rights. And that common language is a really important policy tool in that public health space. Finally, I want to note that the true innovation in this space is really not about what the environment sector can do for public health through the One Health approach, but what public health through the One Health approach can do to help and raise the importance of these environmental and ecosystem issues that are so central to life on Earth. The environment sector is not and should not be an afterthought in One Health governance and in One Health frameworks, but should be a starting point in innovative One Health governance. Thank you.
Monica, you are muted.
Yes, thank you so much, Katie. And now I'd like to give the floor to Maria Feo. Maria, please.
Hi, good morning, and thanks for the invitation for being here. It's a very interesting discussion and presentations. And I'm going to speak about something that is quite linked to what Katie was saying now. So I'm going to share my slides. Okay, do you see them? Yeah.
No, not yet.
No?
No.
Okay. Okay,
Yes.
now?
Yes, and if you could go into full perfect. Thank you.
Okay. Okay, so I'm going to speak about the importance of improving the ecosystem health of urban streams in the context of One Health. So I coordinate One Aqua Health project, which is funded by the Horizon Europe. And the title is Protecting Urban Aquatic Ecosystems to Promote One Health. So this has to be an interdisciplinary project. So we have partners from all areas, from ecology to public health, veterinary, social sciences, informatics, engineering, and even artists. So this covers, we have 14 partners that from 10 countries. And our concept is that the health of the freshwater ecosystems and human health and well-being are interconnected, especially in urban areas. So, as you all know, the rivers and streams, they provide what we call ecosystem services. And these are various kinds, from the provisioning services like provisioning of water or food, but also cultural services and regulation services. Unfortunately, the ecosystems in urban areas are often very degraded, very artificialized, so they don't really provide any or most of these important ecosystem services. In a study that we did, we tried to calculate the risks for human health from the degradation of these ecosystem services. And this is just an example of what came out from real data. So we assessed ecosystem services in urban streams in a city, in Coimbra, actually, for example, the loss of air quality due to the disappearance or degradation of the vegetation in the rivers or in the margins could lead to a risk of 59% of pulmonary diseases, neurological impacts on liver, the spleen, blood, the reproductive system, cardiovascular diseases. And then we have also the loss of climate regulation that could lead to cardiovascular and respiratory diseases up to 56%, and others like the water quality, which is the more known service that is in risk in urban areas. But also we have the loss of education and cognitive development that could lead to losses in the opportunities for the maintenance of cognitive skills or higher education level. The loss of therapeutic services provided by the streams could lead to a poor mental health, and so on. So I'm not going to explain this, but just to let you know that it's quite important to try to link the ecosystem health to the One Health concept. But we don't know a lot about the influence of degradation of the freshwater ecosystem in the health of the organisms and human health. And we also may not have the most adequate indicators. In the Water Framework Directive, this is the European directive that defines how the ecological assessment of rivers is done, which is very similar to what is done in other countries of the world. We assess parameters like the water quality, the physical integrity of the rivers, and also the biological integrity. The biological quality based on aquatic communities. However, this information that we obtained from the ecological assessment of rivers doesn't really indicate the risks for the human health from the degradation of the aquatic ecosystems. And this would be important to include in for example, the plans for the restoration of rivers. So in the One Aqua Health project, we really want to determine some early warning indicators of environmental health degradation for human health, and develop an environmental surveillance system, and also involve stakeholders. So we are building a series of tools that will be interconnected and provide some important information, we hope, for decision makers. We are collecting data also in the field from several indicators that we thought would be important in this context. These are additional indicators to the ones that are usually collected in the ecological assessment of rivers. For example, reservoirs of pathogens, vectors of diseases, also biological controls, physiological health of the organisms, things like pharmaceuticals in the water of the urban streams, and we are also relating these to human health indicators. So we initially defined 22 indicators of ecosystem health and 7 indicators of biological health. And for each of these we establish a rationale. Why should we use them? What's the connection to human health? and also define the methods, derived metrics, and the sources of information. These have to be realistic indicators that really could be applied, for example, by environmental agencies or by municipalities. Ideally, there would be some historical information that we could profit from. And also we would contemplate some indicators that citizens could contribute with some information, for example, through an application. We are collecting data. We already collected, in fact, from 100 streams in 5 European cities with different conditions from the south to the north of Europe to contemplate also different climatic conditions. And the final selection will be part of a document and some fact sheets where we indicate the indicators that better responded to the urbanization are feasible to include in the regular monitoring of aquatic ecosystems and are able to indicate risks for One Health. This will be part of our decision support system, and in addition, we'll have a toolkit of solutions to improve the One Health in the context of cities and freshwater ecosystems. We are working with local alliances that cover all sectors of the society, discussing our tools, our indicators, our solutions. And we have, in fact, here several challenges just to finish. Because in fact, we need to monitor the freshwater ecosystems in a more holistic way. This should be integrated in conservation and restoration priorities that should consider the context of One Health, which is not actually happening now. And for that, we need to involve different scientific areas and societal actors. With the opportunity is that, for example, in the European Union, we have this new regulation approved last year, the New Nature Restoration Regulation, that will oblige member states to elaborate restoration projects. And this is our opportunity to make something different and contemplate the One Health approach within the ecological approaches for the restoration of the ecosystems. And thank you. This is my teams. Thank you.
Maria, a very interesting array of activities. You are doing such important work. And now I will pass the torch to Elena. Elena, please.
Thank you very, very much. We are well over time. There's one more question. One question has been answered. There's one more question that we will answer in the end. But please do send them there because Monica is monitoring. We have the next panel we think is very, very interesting because it's discussing a topic that cannot be ignored, the workforce. All of this is very nice at different levels. So we're very happy to have with us Simon Rueg, who's collaborating and will give us a lot of insights on veterinary aspects, but also different levels of anticipatory work, including for health promotion and prevention. And Carl Coniard from the Public Health Association that usually partners with us for educational purposes, so ASFER. And he is a core curriculum fellow at the University College Dublin, and he will be partnering with Medicode to show us, to present with us the core curriculum that was recently really completely rehauled to showcase One Health and global health. Sorry, I'm going very quickly. First of all, Simon, thank you for being with us from Switzerland remotely. And it's over to you.
Well, thank you very much. I'll try to keep the pace up. So from my side, a quick overview on the competencies. We've heard a lot that, what the actual challenges are. So I'll try to address what we need to then deal with those challenges. And that's how we came about to a paper that we wrote a couple of years ago about the core competencies for One Health. So I think it's important that first of all, we start thinking about, what do you think? What do we think when we think One Health? So there's essentially two streams of thinking. We have one stream that is talking about the interface. So we're essentially just focusing on where the ecosystems, the people, and the animals actually meet, and that's where we focus on. And we would call that much quite a reductionist approach, because it actually focuses in on a very particular place and space and set of interactions. And the other way of thinking about One Health is actually to consider the whole system. So to be way more comprehensive about what we think about, and to consider that if we see an animal that is affected by an intoxication, well, that this actually shares the same environment that we live in, and therefore we should care about how that animal is doing. So we should have an interest in animals, and we should have an interest in plants, because they are part of the same system to which we belong as humans. And I think that's a totally different way of thinking. But somewhere, if you carefully read the OLEB definition to which reference was made earlier, you will actually find that ambition to be comprehensive and to change the paradigm about which we think. So what do we need to do this? Essentially, we need knowledge. So we need a variety of models that we're using to understand the world. So we know that from science, we have a variety of models to understand reality, to interpret reality, but we also have different models from social sciences. We have different models from traditional knowledge systems, and it's really important that we can link this knowledge and to bring this together, integrate it, and identify where we have uncertainties, and start dealing with uncertainties as a fact and not as something to avoid. To get there, we need to build on a set of values and attitudes. So we need to really embrace transdisciplinarity. We need to think, and it was referred to earlier, about equity. We need to refer to equity, to access, inclusion, and inclusiveness. And that is an attitude. It's a way, if we want to do it, we need to push this agenda. You can do a lot of stuff on paper, but the question is, how do you implement it? And this is where your attitudes are going to be the leverage. So we need to teach these attitudes. We need to build that workforce that is going to be capable of putting these attitudes into practice. And finally, there will be skills that we need to actually do this. So we need to effectively communicate. That was referred to earlier. It was said we need to collaborate, but not only just, for one project, but we need to think about how do we establish collaboration in a way that it's going to be resilient. So if we have the next pandemic, that we stick to the promises we made, that we're not just throwing everything overboard and, give in to the highest political pressure that is being set upon us, because we will have established some form of trust and some institutional way of collaborating. And with that, I will end. If you are interested in more deeper discussion of those various aspects, you can find the QR code on the right side of this slide and dwell deeper into this presentation. Thank you.
Thank you very, very much for this insightful and complementary to the other presentations aspect. Although I rushed to introduce because Simon was actually on time. So very happy to have both of you, Carl and Mary, with us. And to say that we have been collaborating and also seeing what's been happening with the curriculum and the work of ASHER for the past few years. And we're very happy to have you with us. And just to say in a more comprehensive manner, so Carl is the ASHER Core Curriculum Fellow of the University College Dublin, and also he's at the Royal College of Surgeons in Ireland and the University of Medicine and Health Science of Dublin. And Mary is Associate Professor of Epidemiology and Biostatistics in the University College Dublin in Ireland. So without further ado, and thank you for sharing screen and being together, I pass on to Carl and Mary. Thank you.
Thank you very much, Elena. Can you hear me?
Very well. And the screen and the slides, everything. Thanks,
Well,
Mary.
I'm very pleased to say we're sitting in the same room, clearly, because my connection keeps dropping. So
very happy too. Thank you.
Just moved up here beside Carl. Just to say thank you for inviting us to participate in this. I think it really is an excellent session. Delighted to be coming right after Simon and your discussion on competencies. And I think this is critically important as we look towards the future and integrating One Health into public health education. What we have focused on through ASFR is looking at curriculum with an objective of underpinning the attainment of competencies. So I'm going to hand over to Carl to take you through the first few slides, and then I'll just finish up.
Thanks a million, Mary, and thanks a million, Elena, as well. So as we battle with the new normal in public health in both education and practice, we really need to ask ourselves, how do we address the challenge for public health education training and practice to maintain currency? And this all comes under ASFR's remit of strengthening education and training for public health professionals in both research and practice. But at the same time, we need to ask ourselves, how fit for purpose is our education and our training programs? And this calls for attention to update curricula to reflect the new knowledge and skills acquired that have really come from that new normal that has presented itself. Relevant to public health academic and training programs at many levels across international boundaries. So ASFR has had a very long history in competency development, starting back in 2006 with the ASFR European List of Core Competencies in Public Health Professionals. This has led on to WHO ASFR Competency Framework in 2020. Recently enough, we had some work with the European Centre for Disease Prevention and Control with our core competencies in applied infectious disease epidemiology in Europe. And then, of course, the ASFR core curriculum. But how do we get to this point of the core curriculum? How do we get here? So this has been part of a 5-stage edited Delphi process that started back in July 2022. We started asking schools about their curriculum, and we ended up really developing these curricular concept maps, which were then looked at via consultation workshops. This led on to subject-specific surveys looking at levels of agreement on content and delivery, and then the lifeblood of the core curriculum, the expert advisory groups for each subject area looked at each specific curriculum to align things to what's actually happening in the field and in curricula currently at the moment. And of course, the expert consultative group brought the product together with a lovely bow. And as you can see with the different stakeholders, schools of public health have been at the core of the project all the way through. So we'll move on. What is JASFR Core Curriculum? JASFR Core Curriculum is developed around 4 domains. The first domain being core subject areas in public health. These are the classic subject areas in public health that we would expect in public health programs: are epidemiology, demography, public health research methods, biostats, the list goes on. Very important there, public health ethics and law for public health. As we move on, we have our subject-specific areas in public health, could be seen as specific streams of training, for example, communicable diseases, but also the important areas which have really come to light, difficulty in conflict and peace building, and of course, emergency preparedness and disaster management. Next, we have our core cross-curricular subject areas in public health. Very importantly here, we can see One Health and global public health. These are subject areas we would expect to be peppered through entire programs and modules, as they are very cross-cutting between all modules within public health programs. And then finally, we also have our core interdisciplinary professional skills in public health. The skills we would expect students and professionals to come out of degree programs and training programs with. So we'll move on quickly. And with that, we will have a very quick profile of the One Health subject area in the core curriculum. And each chapter in the core curriculum has a rationale and current status. This one is specifically on One Health. And as we can see here, the curriculum is divided into different educational levels, all the way through from bachelor's level, master's level, PhD, continuous professional development training, certificates, diplomas, and lifelong learning. Here's the curriculum for One Health for the master's level. We have our important themes of practice: animal health, human health, plant health, and food safety and climate health, and all the different curricular elements that can be used within a curriculum to ensure that students and public health professionals are getting up-to-date and aligned education across the European region. And here's just a bigger view of the themes within the subject area. As I said, the practice of One Health, animal health, human health, plant health and food safety, and also climate health as well, all elements which impinge on One Health. And within the core curriculum, we've also looked at the interconnectivity of subject areas across the entire curriculum. There are concerns that in public health education, there's a tendency for teaching in silos, and we hope to try and get rid of that going forward. Program coordinators facilitate the joining up of across faculty members within their different universities and institutes across the European region. And why? The content analysis, of course, really indicates significant interconnectivity across all areas. As we can see with One Health, not surprising, it is highly linked with every single subject area within the core curriculum. Not very surprising with the interdisciplinary nature that is One Health. And we are very happy to say that the curriculum is also aligned with competency frameworks. And Simon Rug will be very happy to see the Lang et al. Paper there, Advancing One Health, the updated core competencies, which this curriculum has been aligned to, along with the European WHO Essential Public Health Functions, along with the WHO Ask for Competency Framework. If we had more time, I would bring you through the global public health area, but you can easily look at the publication and see it for yourself. So I'll pass on quickly to Mary.
So I will just finish up really, Elena and colleagues, by saying that this curriculum aligns with the mission statement and aspect which Carl has already mentioned to you. Just to say too that he mentioned the ECDC updating core competencies in applied infectious diseases epidemiology. On that occasion, we included One Health in that core competency framework for the very first time. I'm also delighted, just on a personal note, to say, Simon, one of your colleagues on the Lang paper was our colleague here in UCD in the School of Agriculture, Barry McMahon. As I say, my pitch would be brief, but really, I guess we look at this mission statement and say that it can only be accomplished through linkages. Here shown are all of the linkages to all of the schools that Carl has already outlined. And also, okay, through partnerships, I'm delighted to say that this is not manufactured for this talk necessarily, but you'll see EUPHA right up there in the middle and in the center. So partnerships with ASFA member institutions, international organizations, EUPHA, of course, GNAF, the Global Consortium on Climate and Health Education, the European Council on Disaster Management, and the World Association of Disaster and Emergency Medicine, and of course, WHO Europe. And through collaborations, these are snapshots of the expert advisory groups, and you should be able to find the One Health Advisory Group there in the center, overseen as it was by the expertise of the ASFA Executive Board, the working groups that you can see. At this moment, we don't have a working group on One Health. However, we do have a tremendous interest in that area. And that all leads really to the proposal for a multifaceted curriculum, as Carl has already outlined. We really do welcome all sorts of input and hope that you will look at our website and provide us with feedback. We envisage that the components of this curriculum will be and are already, in fact, being applied to program self-assessment and indeed modifications based on that. We're currently developing some toolkits for curricular review. And here's a pitch. We're hoping that a workshop we've submitted to the European Public Health meeting in Helsinki will be accepted, and it's going to be a hands-on workshop using a mapping tool that we're developing right now for program self-assessment. Moving on to developments on online resources and hopefully collaboration and sharing of that material and expertise across programs, recognizing that not every program, not every school, not every center can have expertise in every area. We envisage in the future working with AFIA in particular that components of this curriculum, including the One Health components, may provide the basis for program accreditation, in particular if they purport to have expertise in a particular area. we're so conscious of the fact that we, the trainers, may need to be trained here. And so the vocational training and the CPD component is actually really important. And that's something that we would like to push the boat out, perhaps through EUPHA, in terms of training the trainers, all with a view to the future and encouraging and enthusing our early career professionals in this area. So I think we're done. Thank you very much. This is the website. Please go online and take a look. Move in through the little next button and you'll find how we went about it, what resources are there, including an extensive resource library. And you have the opportunity to provide feedback on the first edition, which was launched last November. And you can keep going. Yeah, there. Thank you. That was the launch at EPHC last year, and we hope by the EPHC this year to have updates and let's call it a second edition. So thank you very much.
Thank you, Mary and Carl, and good to see Alison and many other people there. And just to say that from practical experience, because we were playing in quotation marks with my students last week with the curriculum, we found it very easy to go in and out and navigate. And the graphics showing overarching complementarities are good because most of our students come from very different backgrounds. Linking back to self-assessment tools. I think we have many more events coming up, and perhaps Carl wants to mention that there's one more event later on, or I think also Charlotte for ASFER, for workforce. But just in the interest of time, because with Simona and I, we were very ambitious, I think, and thanks to everyone, I will pass on to Monica to coordinate us for final remarks. Monica?
Perfect. Thank you so much, Elena. So because we are already well over time, thank you so much for everyone for staying with us. And we would like to get 30 seconds, a final remark from everyone. And we will start with people in the order that they've spoke. So the first person that I would like to invite for a final remark would be Charlotte Marchandise. Charlotte, please.
Well, my call is let's go for action. Let's go to build bridges because it was so interesting, but it was also so complex. And having been a mayor, having been training lots of mayor in, very hands-on, how do we translate all this knowledge into tools that are accessible, and how do we scale up? There are amazing experiences everywhere, like Utrecht municipality has a living lab. How do we connect researchers to be on the ground and do interventional research to learn from the ground and from the communities? Thanks a lot. Looking forward next steps.
Thank you so much, Charlotte. Then I would like to invite Sinaya. Sinaya, please.
Thanks. We've heard many angles, and I myself, particularly as an expert on environmental issues, I was really very happy also to hear more input on tackling this One Health from environmental point of view. The importance to really be successful in addressing One Health and accelerate implementation and operationalization. We must address governance and capacity and financing, and we should not be shy away from looking into this governance that is suffering from so many issues, from sharing of data, from regulatory aspects, etc. So again, this is a key message for me. To look into that in the future. Thank you.
Thank you so much. Indeed, we have to look into the future, and I would like now to invite Julia for her final remarks. Please, thank you.
Hi, thanks. Yeah, I guess the main thing, having worked on the pandemic agreement, is really just to give an appreciation of the interconnectedness of the world. Obviously, we're frequently talking about EU context, but really we need to keep in mind that we're an interconnected world, changing global geopolitical situation. And I think the pandemic agreement really reflects the different priorities amongst countries, which is something that we kind of need to be mindful of. And then, yeah, next will be the implementation. So this will be heading that way. Will be important to keep the political momentum. Many thanks.
Yes, and the political momentum is crucial. Marlene, please.
Yes, thank you, Monica. And just building on that last remark, I think, yes, we are in very turbulent political times within different countries and across continents. I think it's important to take into account the changing realities in the use of the rule of law, for instance. And I'd like to invite you, if you have time, we have a webinar this afternoon at 3 o'clock discussing the implications of all the decisions on global health and including One Health. And as for the current situation in One Health governance, I think my main recommendation is to, rather than continue repairing the damages of our economic production and trade patterns, we really need to strengthen coordination and collaboration with those economic production sectors like agriculture, industry, trade, and really start understanding how these sectors operate and where are the points of leverage to introduce the One Health approach. Thank you.
Thank you, Marlene. Yes, I agree. I feel that collaboration is needed more now than ever, maybe. Simon, please.
Yeah, thank you. Well, first of all, I'm absolutely enchanted to be here at all as a veterinarian in a public health arena. Then secondly, I'm absolutely enchanted on how often work that we have conducted over the last 10 years has been cited throughout the different works that I have seen here. So I couldn't be more happy than what I am. I'm really glad to have met you all, and I hope that seeing how fast things are moving in my view, right direction, I'm more than confident that we will make the right transformation. Thank you.
Yes, thank you. Together we can make the right transformation. Carl, please.
Of course. So for me, one of the biggest things which is very important is ensuring the inclusion of young career professionals in all elements of research, but also in all elements of practice as well. Multi-generational pathways is the only way we can ensure that everyone's voice is heard at the table. So that's my 2 cents.
Well done, Carl. Thank you for that. And I echo that and also echo what Simon said about being delighted to be included here. If I can simply say that collaboration has come through in most of what you've said, I totally agree with that. We for sure would welcome feedback on the work that is ongoing at this point in time. When we think about the changing landscapes, conflict, war, the rise of infodemiology and its double-edged as a double-edged sword. And of course, we've not totally dismissed or not really discussed the issue of artificial intelligence and how it's all going to change all of our lives, in both our regular lives, but also in our education systems, and hopefully for the better. That's really my pitch. Let's get your feedback and let's continue to collaborate.
That's amazing. Thank you so much, Carl. Thank you so much, Mary. And now for the final remarks, Elena, Simona, please.
First Simona, and then maybe Simona, please.
No, thank you, Elena. I just would like to thank all of you. It was a kind of adventure to organize in a very short time this webinar, but I think the results is great. I'm very happy we were able to go across and navigate across so many issues, some very dense that we have maybe to dedicate just one webinar for some topics. So I really would like to thank you and also to thank EUPHA for inviting as a daily partner WHO Europe.
Thank you very much. Just to say, we're aware of the complexity of the topics, and I think going backwards from the curriculum, there are other competencies for negotiation, for advocacy, and so on, that are becoming critically important. And these are things that those of us that come from a medical background, we are not trained in. So there could be, I think, benefits to discuss other things. So we want to raise awareness of what's happening, and we don't want to be disjointed from our communities. And to this effect, we hope that we will have many more events. This is just a slice for this topic. Also to say thank you to everyone, because really for internal reasons, we had to really put this event very briefly together. echo what Charlotte said about a call to action and to say that we are already discussing taking further steps for AMR. We have done a lot of work on AMR. We've talked with the Joint Action with Jamray and with many innovative projects. So we hope to announce over the next few days the next event, beginning of June and then September. So I think unless Charlotte, I do not know if you would like to have, yes. So thank you everyone for staying for a very, very long session. Have a wonderful rest of the day. And as to what Marlene said, if you're more interested about aspects of the pandemic and what's happening with political things and indeed standing up for science, there is another session coming up this afternoon, quite high level, where we join forces with our colleagues across the Atlantic at the American Public Health Association, which is also, I think it's time for collaboration, but it's also time for joining forces globally. So thank you all very much. And best wishes to everyone for a wonderful rest of the day.
Thank you. Bye bye.
Bye.
Bye bye. Thank you.
Bye bye.